large amount of siblings. I have 3 half brothers, 2 half sisters, and 2 full siblings, and a brother and a sister. Victoria is my full sister. Her full name is Victoria Lynn Gilbert. She was born on June 30th, 2004. Mom says she came out kicking and screaming, ready to take on any challenge the world was willing to throw at her. She came out at 6 pounds, 12 ounces at 19 inches long. What happened to her? My mom had to be induced at 38 weeks at Good Samaritan Hospital in Cincinnati, Ohio. The hospital had a team of pediatric, pulmonary, and cardiac, surgeons in the room when she was born, expecting to take her straight to surgery. My mom had a few minutes to hold her after birth. Shortly after, she was immediately taken by the pediatric cardiology team. They took her to Cincinnati Children's Cardiac, or NICU. What was she diagnosed with? When she was born, she was diagnosed with hypoplastic left heart syndrome. This means the left side of her heart didn't work, which made her right side pump twice as fast, but her whole heart was still there. Teams had to react fast. She had her first open heart surgery at 3 days old. The surgery lasted about 9.5 hours, and they called the surgery Norwood. The recovery after her first open heart surgery was a struggle for someone so small. She remained on a ventilator for 2 weeks. Mom couldn't hold her again until July 10th, 2 weeks after giving birth. She came home for the first time in August 2005, several months after she was born. Victoria was very fragile, so pediatric team was present while Mom held her for the second time. Between surgeries, she had multiple heart caths. At 9 months old, she had her second open heart surgery called the Glenn operation. After this surgery, she developed extreme pulmonary hypertension. Pulmonary hypertension means that her blood pressure in her lungs increased so much that they were starting to shut down. She spent 15 months total in the hospital. In the end, her little body wasn't strong enough to fight anymore. Her little lungs were overworked. After the surgery, she needed not only a heart transplant, but also a lung transplant. She left the family to go to a better place on November 12, 2005. HLHS.